Good evening everyone. Welcome to a brand new episode of BMC Global Live Al-HILAL Health World, Nothing But Lifestyle. I am Anupama Menon. Good health is not a destination, it's a journey. In this talk show Health World, we have expert doctors from various fields providing valuable information to all of you to assist you all on your journey towards good health. Osteoarthritis is a very common problem faced by a lot of elderly people. This can be extremely painful and can actually prevent the patient from leading a normal lifestyle. To give us a deep insight into this problem of osteoarthritis, we are joined today by Dr. Bijith Balan, Specialist Orthopedics at Al-HILAL Hospital, Rifa. He comes with an experience of 12 years in the field of orthopedics, and his area of expertise is knee replacement and spinal surgery. So let's go over to him and know more about this issue. Doctor, welcome to the show and thank you for joining us.
Hi, good evening. Thank you everybody.
So before we start, doctor, could you please explain to us what exactly is osteoarthritis in medical terms?
Osteoarthritis itself is a irreversible progressive degenerative synovial joint disease. Basically our body's weight and balance is controlled by joints. So what happens whenever the joints there is any kind of articular damage happens, this will leads to arthritis. Most of the time knee joint and hip joint are more prone for arthritis because this hip joint and knee joints are the one which is carrying our weights.
Okay, and is the geriatric population, the elderly patients more affected by this?
Yeah, elderly population most of the time we can see they are affected by osteoarthritis, but nowadays even in younger individuals also we can see osteoarthritis.
In your observation, what are the common causes that could lead to this condition?
It's a good question. In etiological wise causes we can divide into osteoarthritis causes, modifiable and non-modifiable causes. That means modifiable causes, if any previous injuries in the knee joint or hip joint during childhood days, that can leads to the articular damage of the joint. Next comes any obesity. Obesities can also leads to osteoarthritis.
So these are modifiable causes that you are talking about.
We can change by our lifestyle modifications, all these things.
So obese people are more prone to getting osteoarthritis,
yes,
because maybe the weight is on
yes,
there.
the weight transfer through the hip and the knee joint. So whenever people are more obese, the knee joint
more
more prone to osteoarthritis. The knee joint will carry the weight, and there will be a damage of the articular cartilage in the knee and it will expose the subchondral bone. Later on this will leads to osteoarthritis.
Okay, so you spoke about the modifiable causes.
Yes,
now.
yes.
I'm sure there are a few non-modifiable
Yes,
causes
yes.
as well. So could you please elaborate about
Non-modifiable causes, as we already said, it's a senile disease, it's a age related.
Okay.
Whenever age goes up, there will be like any other age related disease. Even in osteoarthritis also there are so many changes happening in the joints. So this can leads to articular cartilage damage and this leads to osteoarthritis.
And doctor, what are the common symptoms? Because after certain age, small aches and pains are very common for any elderly patient. So how would you know that this is not a common joint pain or a muscle pain, or this comes in the category of osteoarthritis? Are there any symptoms specific to this condition?
Yes, there are symptoms which are specific to osteoarthritis condition, that especially patients when they come to the clinic they will tell us the pain at rest. When they are resting also the pain will be there on the knee joint. Second thing is like when after all the day-to-day activities work, then when they go to sleep there will be mild swelling started on the suprapatellar area. That means on the thigh area there will be mild swelling.
Okay.
These are the main symptoms they will complain.
So the pain and the swelling, these are the red flags that the patients have to.
Exactly.
So doctor, you said this could also be a lifestyle disease like obesity and all that could contribute to this. So what is the role of uric acid? Because if uric acid is left untreated, do you think that could lead to osteoarthritis?
Yes, that's a good question. Especially in Middle East population, due to the sedentary lifestyles, what we have seen is most of the patients who is come to the clinic, we will check their uric acid also. When they say they have pain in the knee joint or the hip joint or even in the shoulder joint, we will check with their x-rays and uric acid levels. The uric acid, if it is more than the normal value, that means it is more than 7 or 6.5 above, we will consider the uric acid medicines also we will give to the patients, because uric acid there is a crystals, monosodium urate crystals. These crystals can damage the synovial membrane and the articular cartilage inside the joint. So, this can also leads to arthritis very fast. It can aggravate the arthritis, progressiveness of the arthritis will increase very fast.
So, it is very important that the uric acid is kept under control. So,
exactly.
this also comes as part of your lifestyle choices,
Exactly.
I guess.
Yes.
Too much of non-veg intake and all that could lead to higher uric level acid. So, doctor, now if you could just tell us about the treatment, how is this managed? Once a patient is diagnosed with osteoarthritis, how do you go about managing this?
Before coming to the management part of osteoarthritis, we need to know about the grades of osteoarthritis. We have divided osteoarthritis into 4 grades according to Kerlagan classification, the orthopedic side. There is grade 1, we have grade 1, the patients comes with minimal pain. Such patients we can manage with minimal lifestyle modification and physiotherapy exercises. And grade 2 patients, if they are having little more pain with swelling over the suprapatellar region, that means just above the knee joint there will be little swelling. Those kinds of patients we should manage with analgesics, that means the painkiller, and minimal dose of steroids sometimes we give to reduce the synovial swelling and synovial membrane thickening, all these things we will give this medicine. Sometimes even we use injection techniques are there, that means corticosteroid injections, or we have got viscous hyaluronic acid, wonderful injections we have got. These injections we can give for grade 2 patients. Even in grade 3 also, to a minimal extent patient we can give these injections, they will have wonderful relief from the pain. And when we come to the grade 3 and the grade 4, the final stage, surgery is the option of treatment.
So, surgery is the last resort when the patient reaches grade 4. Now, let us say patient is diagnosed with a stage 1, grade 1 or 2 as you mentioned, with mild symptoms. Do you think further progress of this can be arrested with the help of medicines, or how do you treat that at that point?
When we diagnose the osteoarthritis little earlier, we can delay the progress of the disease.
It can be.
Yes, we can delay the progress of the disease with injections, with PR platelet rich plasma injections and hyaluronic acid injection. We can delay the progress of the disease. We can't stop the disease completely, we can't, because it says, I already told, it is a senile age related disease. So, same like how our hair is becoming grey, the disease itself, it is age related. So, we can delay the progress of the disease.
So, doctor, you spoke about surgical intervention. So, what are the kind of surgeries that are normally done for this condition? We have heard about implants, knee implants, and hip replacement. So, does this all come under these surgical procedures?
Yes, surgeries, when we talk about surgeries, older conventional method of surgery is total knee replacement surgery. But nowadays we have got different kinds of surgeries in osteoarthritis. The latest version and controversial version of surgery, one is proximal fibular osteotomy surgery. That is, without changing without resurfacing the joint itself, we can control the osteoarthritis with a newer method of surgical method. It was actually come up in Mexico initially. Now, in India also this is followed in many parts of India itself, that is proximal fibular osteotomy. A part of the bone we will trim it off, and so we told the surgery we have got proximal fibular osteotomy surgery. That is a newer method of surgical technique. What we do not resurface the joint that means we don't total knee replacement, we don't change the knee joint with the metal implants. We will just balance the mechanical axis or the axis of the knee by removing a small part of the fibula bone, that is proximal fibular osteotomy surgery.
And can the patient go back to a completely normal lifestyle after this surgery is done?
Yes, normally nowadays we have got excellent surgical innovations. Due to that, immediately postoperatively, immediately after 6 hours or 10 hours, we will make the patient mobilize with the help of centrally acting analgesics. That means, if we have got a epidural with the epidural analgesic technique, with the help of an anesthetist, we can make patient mobilize, and post operatively 6 to 8 weeks of within 6 to 8 weeks
That's
of
a recovery period.
Recovery period.
And is it a painful process? I mean, the recovery time, does the patient have to go through pain and other discomfort?
No, it is like minimal pain. For that, we will add pain relief medicine, centrally acting pain relief medicines,
Okay.
and followed by mild physiotherapy exercise. All these things we will give to the patient.
So the patient can be back on the feet maybe within 8 weeks or so.
Yes, yes. 6 to 8 weeks we will make the patient to go back to normal
Completely
daily routine
normal
activities.
lifestyle. And you spoke about new advanced technology. We have also heard about computer assisted knee replacement.
Yes,
Could you please
yes.
throw some light on that?
Yeah.
What exactly is
Computer assisted knee replacement, in the advantage of computer assisted is like when we are doing the surgery, the more accuracy for the surgery we will get. Meanwhile, there will be minimal bone cuts. We can assure for the minimal bone cut to the patient. So, it is more advantage.
And is it widely used or?
Nowadays, it is widely used in many of the hospitals.
Doctor, you mentioned initially that even though osteoarthritis is seen mainly in elderly population, there are cases where youngsters also get this.
Yes.
So what could be the reason behind that? Is it again due to lack of exercise or sedentary lifestyle, or is it some kind of an injury that later leads to this kind of a condition?
Yes. Young population, when they have an injury or anything, they will just neglect it. So what happens inside the knee joint, there are cushions like meniscus, and we call it as meniscus and ligaments, that is ACL and PCL. So when this get damaged, and when they neglect this, in future when they go with the same damage, when they again go for sport activities, all those things, this meniscus will completely get tear off, and like that the bone and the bone will get started rubbing each other. And as I already told, there is an articular cartilage. It is like a sheet that comes under the bone, that is the femur and the tibia. So this articular cartilage get damages, and it can leads to osteoarthritis at the earlier age itself.
Early ages.
Yes.
Okay. So doctor, before we wrap up, any takeaway message for our viewers that you would like to share?
Yeah, like any other disease, this osteoarthritis is also a lifestyle disease. So to a certain extent, we can delay the progress of the disease by lifestyle modifications, like daily routine exercises, like controlling your food, that is eating purine low dietary foods that will control your uric acid levels. So yeah, like any other disease, osteoarthritis also to a certain extent we can control with lifestyle modifications and daily routine exercises. So daily exercises and
healthy
lifestyle will delay the progress of the disease.
Okay.
Yes.
Thank you so much, doctor, for explaining to us in detail about osteoarthritis. We appreciate it. Thank you so much.
Thank you, madam.
So friends, as doctor rightly pointed out, osteoarthritis is something that can be treated and cured. The only thing that you have to do is take care of your lifestyle, eat healthy, exercise regularly. So please do follow doctor's advice. Prevention is always better than cure. Till we meet again next time, this is Anupama signing off. Good night, stay healthy and stay happy always.